Good morning. I'm Jennifer, the Associate Director of Human Resources for Cochise County, and welcome to our open enrollment meeting via Teams. Thanks for joining us. With me is Lisa Culp, our HR analyst who oversees benefits, and we will be presenting to you today. Although we are doing this virtually, I don't want you to think that HR is not available for you. Feel free to call us at 9700 with any questions. We can do that over the phone, via Teams, or figure out something to make sure that you are well informed to make the right decisions for you and your family. And so without further ado, I'm going to turn on our PowerPoint, which, by the way, is available. This deck of slides is available on the benefits page in the Human Resources section of our Cochise County webpage. So without further ado, let's get this going. And I will turn this over to Lisa.
Thank you, Jennifer. Hello, welcome everyone to Open Enrollment. As we know, Open Enrollment takes place April 1st through April 30th. And it's the only time of the year you can make changes to your benefits without a qualifying event taking place. Any changes you would like to make will be done on ADP and must be submitted by April 30th. If you wish not to make any changes to your coverage and are not wanting to participate in the flexible spending account, no action is required. However, you will need to complete a form to enroll or re-enroll in a flexible spending account. And if it is your initial enrollment into the health savings account, a completed form will need to be returned to Human Resources as well. What is new for the 2021-22 plan year? There are a few changes this year. The first is a nominal price increase on all medical plans and the removal of a limitation on prescriptions for HDHP participants. For those who would like to cover dependents for vision and dental until age 26, this can now be done as well, without proof of full-time student status. We do, however, need proof on file of their eligibility. What is the difference between an exclusive provider organization and high deductible health plan? With the cost sharing EPO and EPO buy-up plans, there's immediate cost share with copays. And you may elect a flexible spending account. With the HDHP and HDHP buy-up plans, you must meet deductible prior to any cost share. There are a multitude of no-cost preventative drug prescriptions. You do pay lower rates and may elect a health savings account. Keep in mind, whatever plan you choose, using a provider in the Blue Cross Blue Shield network will provide you with the most coverage. When you enroll in the EPO plan, benefits are payable only to contracted Blue Cross Blue Shield providers, except in the case of a life-threatening emergency. Members will pay a set copayment for services as outlined in the summary plan document, such as doctor's office visits and prescriptions. Before the plan's benefits take effect, you must meet the plan year deductible of $500 per individual and $1,500 for family. Co-payments do not apply to the deductible. Co-insurance is the percentage of eligible expenses that members and the plan share when care is received. The plan pays 80% and you as the member pay 20% after the copay. You are responsible for your share of co-insurance until reaching the plan year out-of-pocket maximum. The out-of-pocket maximum is the most you will pay for eligible services during the plan year. When you reach the maximum, the plan pays 100% for eligible major medical services for the remainder of the plan year. The out-of-pocket maximum is $6,000 per individual and $14,300 for a family. Deductibles and medical co-payments accumulate toward the maximum out-of-pocket, and your prescription co-payments will apply to the out-of-pocket maximum.
And please be advised, all of our summary of benefits for our plans are located on the benefits page of our website.
With the EPO prescription plan, there was no change. We do have the maximum out-of-pocket still for the individual of $6,000 and for the family at $14,300. There's still 3 ways to fill your prescriptions. You have your retail 30-day, retail 90-day, and mail order 90-day. We also are offering the 3-tier levels: generic and low-cost brand name, post-formulary brands and high-cost generics, and your non-formulary brands and generics. This slide shows you the rates for the employees per pay period and the generous contributions made by the county. Please be advised, we are experiencing a nominal rate increase in 21-22. The Board of Supervisors voted to split the rate increase with employees 50-50. This slide shows you the differences in this year's plan rates and the plan rates for 21-22. For example, last year, the employee cost was $23.08 per pay period. Starting in July, it will be $23.74 per pay period, which is a difference of 66 cents. When enrolling in the EPO plan buy-up, benefits are payable, again, only to contracted Blue Cross Blue Shield of Arizona providers, except in the case of a life-threatening emergency. Members will pay a set copayment for services as outlined in the summary plan document, such as doctor's office visits and prescriptions. Before the plan's benefits take effect, you must meet the plan year deductible of $250 per individual and $750 for a family. Co-payments do not apply to the deductible. Co-insurance is the percentage of eligible expenses that members and the plan share when care is received. The plan pays 80% and you as the member pay 20% after the copay. You are responsible for your share of co-insurance until reaching the plan year out-of-pocket maximum. The out-of-pocket maximum is the most you will pay for eligible services during the plan year. When you reach the maximum, the plan pays 100% for eligible major medical services for the remainder of the plan year. The out-of-pocket maximum is $4,500 per individual and $11,000 for a family. Deductibles and medical co-payments accumulate toward the maximum out-of-pocket, and your prescription co-payments will apply to the out-of-pocket maximum. On the EPO buy-up prescription plan, it has remained the same. Maximum out-of-pocket is combined with medical, and for the individual, it is $4,500, and for a family, $11,000. Still offering the 3 ways to fill your prescriptions and the 3 tier levels. This slide shows the EPO buy-up rates for the employee per pay period for the new plan year and the contributions made by the county. Again, we experienced a nominal rate increase in 21-22, and the Board of Supervisors did vote to split the rate increase with employees 50-50. This slide shows you how the rate increase will impact you per pay period. Again, the employee for this plan year is paying $39.60 per pay period. Starting in July, the rate will be $40.26 for a difference of 66 cents. If you choose the EPO or EPO buy-up plan, you may elect the flexible spending account. Flexible spending account are pre-tax contributions made by you, the employee, to pay for qualified medical and dependent expenses not covered by the insurance plan. Also, if you elect to waive medical, you may still elect to participate in an FSA. Previously, the maximum amount you were able to carry over to the next fiscal year was $500. This has been increased to $550. Any funds in excess of $550 on July 1st will be forfeited under the use it or lose it rule. Now remember, if you want to continue your FSA after July 1st into the 2021-2022 plan year, an enrollment form must be submitted. FSAs are also available for dependent care. Minimum contribution for dependent care is $100, and the maximum is $2,500 to $5,000, dependent upon your tax filing status. You may also elect a dependent care FSA if you are on the HDHP plan.
Okay, so this is Jennifer, and I'm going to talk to you about high deductible health plans. And so, with all of our plans, getting these services in the Blue Cross Blue Shield network is a way to get the most out of your plan. So with this plan, nothing is covered at all until you reach the deductible, which is the same as the max out of pocket of $3,000 for an individual and $6,000 for family. And then once those deductibles are met and the max out of pocket in network, the plan pays 100%. Out of network, once the deductible is met, the plan only pays 50% until the maximum out of pocket is met. You'll notice the out of network, deductible, and max out of pocket are substantially more. One of the things that I find really great about this plan is something that was added last year and was one of the reasons I chose to switch to a high deductible plan. and that is the multitude of preventative drugs at no cost. So I'm going to step away from this PowerPoint for a moment and get over here to share with you the list of medications available at no cost. Okay, bear with me here. Okay, so this document is located on the Human Resources page of the county website. Go to that orange tab to the left. When you log into that page, click on benefits and you will find a number of documents regarding benefits. So this is the list of medications that are available at zero cost. It's a substantial list. And so as you are considering your benefit, your medical benefit for the coming year, you very well may want to look at this list and see what prescription meds you are on, if they're on the list, and how that would impact you if you got them at no cost. Okay. So going back to our PowerPoint. Okay, so with the high deductible healthcare plan, we don't have any prescription plans. Everything goes towards that deductible, though. Keep that in mind. So here are the rates associated with the high deductible healthcare plan. And again, you'll notice the cost of the plan, the generous county contribution, and what it will cost us starting July 1st. You'll see that going to move on to the next one here. So comparing this year to next year, you'll see that currently the high deductible healthcare plan costs employees $0. Starting July 1st, the cost will be 66 cents per pay period. So that would be the difference per pay period is 66 cents. So needless to say, the rates on the HDHP are attractive. If you're looking at yourself and your spouse or child or family, it's going to be about $1.38 or so. Okay, if the high deductible health plan intrigues you, however, you're looking at that deductible and thinking, I don't know, you very well may be interested in the buy-up. And with this plan, you have a lower deductible and you have a max out of pocket. And again, we got to keep it in network if possible to get the most from our plan. So with the buy-up, you meet the deductible and then 10% is paid by the member in network and 90% is paid by the insurance. And then once you meet the max out of pocket, everything's covered 100%. If you go out of network, you're going to have a lower amount covered. And this also includes that list of preventative drugs at no cost. So with a lower deductible, you have higher rates. And so, for example, with a single employee, it would be $46.81 per pay period. Employee child, $113.07. This does reflect the nominal increase we are experiencing on all of our plans. As you can see, for the employee, a 66-cent increase per pay period, and for the others, $1.39 to $1.38. Now, the biggest benefit of the health is a health savings account from my perspective. So talking about what is a health savings account, we call it an HSA. It is a tax favored bank account, and you make pre-tax contributions, and the county also makes contributions. And this account can be used to pay for qualified medical expenses not covered by your plan. And so as you're working on getting up to that deductible, you can pay for all of your medical expenses. You can pay for dental work. You can pay to have your eyes checked, new glasses, and a number of different medically related things. There's a full list. If you would like to explore that list, there's a link there to irs.gov. So in order to have a health savings account, you must, by IRS law, be enrolled in a qualified high deductible health plan. You can't be covered by anyone else on a plan that's non-qualified, cannot be claimed as a dependent on another person's tax return, and you cannot be enrolled in Medicare. The county makes contributions to our HSA as well. The county contributes $500 annually to your HSA. So every pay period, you will see $19.23 go into your HSA from Cochise County. In addition, your participation in wellness activities can earn you up to $500 towards your HSA. If your spouse is on our plan and participates, that could be up to another $500 in your HSA. So the way it works is quarterly. You are provided with funds in your HSA for the wellness activities you've participated in the previous quarter. The way it works is, say, for example, we recently had a wellness activity. It was a health risk assessment. And if you attended that and you're on the high deductible plan, you'll receive $25 in your HSA account for your attendance. If your spouse also attended who's on our plan, you'll get another $25. But if you sign up for the nursing consultation with the nurse, you sign up for that, you do that. Instead of $25, you're going to get $250. Same thing with your spouse. If they also sign up and participate in the nurse consultation. Pretty sweet deal. Also, twice a year, you can convert excess paid time off into up to $500 in a health savings account contribution. So, some more advantages of the health savings account. It just rolls over from year to year. There's no use it or lose it thing going on. You've got tax benefits on your contributions, and it goes with you. So let's say, for example, you decide to move on to another opportunity outside of the county. This follows you. And let's say, for example, you decide to just stay here with us and retire. those funds go with you. If you are fortunate enough to retire prior to age 65, you can continue to use those funds for medical expenses. However, after age 65, these funds can be used for non-medical expenses. Pretty cool, huh? So it makes it a great way to save for retirement. All right, moving on. Let's talk a little bit more about the wellness program that we have here at the county. The way it works is every year, each plan participant has a bucket of $500 for which you can use to participate in wellness activities. Now, these could be physician provided. For example, if you go and get an annual physical, and on the way out the door, they want you to pay for your visit, you just let them know, hey, this is on my wellness. It's covered by my insurance. We also have a number of on-site screenings, and they also, those go towards that $500. Whenever you see a flyer on a wellness opportunity, down on the bottom, probably pretty fine print, it tells you how much that costs. So that would be applied to that $500 bucket of money we have for you to participate in wellness. And then again, if you are a high deductible healthcare participant, there's another $500 out there waiting for you to earn through your participation in these types of screenings. And I'll have all of this information posted on our benefits page. And this calendar for next year with a very fine print that you can't read, again, I will have that posted on our benefits page. Okay, so let's talk about dental and vision. We've got good news on 2 counts. Number 1, no change in rates. That's pretty sweet. Number 2, for those of you who have been wanting to insure your dependents up to age 26, you're going to be able to do that starting July 1st, and you are not going to have to show proof of full-time student status. So, open enrollment is the time to get your dependents under age 26 enrolled in dental or vision if they haven't been previously and you're interested in covering them. So as far as the dental benefit, it's a good benefit. You get to have your teeth cleaned twice a year, x-rays once a year, walk in, walk out to someone who is in network. You know, you go to a dental provider in network, you pay nothing. If you have a cavity, they cover that at 80%. If you have something more intense, that's going to be covered at 50%. More and more evidence shows that dental and heart health are linked, that we're all connected. Wow, crazy, huh? And so I encourage you to take good care of your teeth because you're taking good care of your heart at the same time. Our vision provider, we've used the network that IMED has provided for a while. However, we had Emeritus as kind of our middleman. We've gotten rid of the middleman. We still have the same rates. However, our network is going to be expanded now through IMED. So this insurance provides us with discounts for eye exams, lenses, contacts, and vision correction procedures. So life insurance, as you probably know, The county provides you with life insurance in the amount of your salary, up to $50,000. And open enrollment is the time to purchase any additional insurance if you're interested. Also, the county does provide your spouse and children $2,500 each in life insurance. And again, we hope you never use this stuff, but just in case. So if you are interested in either adding voluntary life insurance or increasing your life insurance, now would be the time. Information on rates are available on ADP, as well as our benefits webpage. So another benefit provided to us by the county is an employee assistance program. This provides confidential life services for not only you, but also your household. And I would like to stress confidential. The county or HR, we never know who uses this. It is completely confidential. A big part of this plan is counseling that is available. And that can be accessed by calling the 800 number here, which is 800-343-3822. Keep in mind, this is not only for you as the employee, but your household, and your household members do not need to be on the insurance. So for example, if you have had some life changes and the way that your household looks, you've had people move in with you and you're struggling with that, you can call and you can get some tools with a counselor to help you deal with that. Perhaps the new members of your household are struggling with having to live with you. Well, they can also take advantage of counseling services. It's not just about your typical things one thinks about people go to counseling for like perhaps anxiety or depression. It also has to do with getting those tools. If, say, for example, you're having trouble with a colleague or a boss or a neighbor, you can call and talk to someone about getting some tools to help you deal with these things. Now, the website is a wealth of information, and to access that, you will need this registration code, but I encourage you to check that out. More services that are available through the EAP are listed here, and we have financial and legal services available to us, and what that consists of is a 30-minute consultation at no cost, and there's also discounts on those same services if 30 minutes doesn't cut it for you. We also have telehealth services. During these interesting times of COVID, going places in person isn't always something that we want to do or that we can do. So a lot of these services are available through telehealth. On awpnow.com, so much good information, professional development, great articles, recipes. I encourage you to check it out. Also, we have available to us on that site, Willmaker. So if you've been thinking, you know, I really need to do this, this program is available to us for to make wills and trusts, and there's some other legal documents as well. So check that out. That's our employee assistance program. So just so that you are aware, we do have a new AFLAC representative. Her name is Kellyanne McGarry. And Here is her contact information. And that is where you go if you are interested in any AFLAC products. It is not available through our open enrollment portal on ADP. So I encourage you to contact Kellyanne if you're interested in any AFLAC products. So some of the benefits that are available are listed here. And what AFLAC does is if you find yourself in a bad spot, in the hospital, having an accident or these other things, you get reimbursed. You submit a claim and they pay you money. So it is a benefit to consider. And they also offer cancer care, critical care, supplemental dental and vision insurance. So keep this in mind as another voluntary option for you. At our request, AFLAC started to offer a short-term disability plan. And the reason for this is that short-term disability is provided to you by the county. However, it can only kick in after you have gone for 45 days without pay. It's a long time. So the short-term disability plan through AFLAC helps take care of that gap. So you can get to that 45 days with some backup money in your pocket. I sent out an email to everyone the other day reminding you that we do have Nationwide available to us as a deferred compensation plan. What Nationwide offers is 457 and 457B plans. These are kind of like a 401k for those of you that have been in the private sector. But the cool thing about Nationwide is you can join or make changes any time of the year. You don't have to wait for open enrollment. So if you're interested in setting up this supplemental retirement plan, you can contact Clark Crowder at the phone number that is shown here. And we will have this posted on our website as well. If you would like to perform an account review on this slide or the one that's on the under the open enrollment section on our benefits website, cut and paste that link down there and you can schedule a time to speak with Clark to get this rolling and to get it to a place where you can achieve your retirement goals. Okay, so the next step, open enrollment starts on April Fool's Day, and that is the truth, and goes through the 30th of April. So if you are going to make any changes, make sure that you go into that open enrollment portal in ADP by April 30th and submit your changes. For medical, dental, vision, only if you are wanting changes do you need to go in and do that. If you have a flexible spending account or want one, you need to complete a form and get that submitted to HR. If you do not currently have a health savings account but are signing up for an HDHP and want one, you will need to submit a form. Or if you want to increase or decrease your contribution. If you're interested in additional life insurance, that would be something you would do through ADP. And this is always a good time of year to remind people to keep your beneficiaries up to date, not only for your life insurance, but also for your retirement system, be it Arizona State or public safety. Important to do that. So on that note, I'd like to thank you for your time and your attention today, and for all you do here at Cochise County. It is appreciated. Thank you. Don't hesitate to call us at 9700 432 9700 if you have any questions whatsoever. We want to make sure that you and your family have the coverage that you want and need. Remember that your benefits are a large part of your total compensation, so make sure that it counts. Take care, and thank you all again.